Hello, everyone. My name is Hiltrud Dawson. I am, sorry, got something in my throat. I am one of the health promotion consultants at Health Nexus, and I just would like to welcome you all to the webinar. We'll give it another minute for people to join. Sorry. Okay, well, I think we will get started. We have quite a few people on already, and I'm sure there's a few more coming. Again, I'd just like to welcome you all to this webinar. It's just going to be a short webinar. We'll talk for probably about half an hour or less, and then there'll be time for questions. My name is Hiltrud Dawson. I am health promotion consultant and team lead at Health Nexus. And I have with me Pascal Gagné, who's also a health promotion consultant at Health Nexus with his special expertise in FASD. And that is what we are talking about today.
Hello, everyone, and welcome to this webinar.
And I just want to make sure that we're recording because we are going to, yeah, okay, you can see it. Great. Okay. All right. So we are going to talk today about a province-wide fetal alcohol spectrum disorder training for service providers across sectors that we have been developing and that is almost ready to go live. So we looked at preparing for this training, we looked at the community needs, and we've been working with MCCSS, the Ministry for Community Services. We've been working with them to make sure that we have this as a support for all service providers who are working with individuals and families with FASD. The literature indicates that service providers lack the competence and the confidence they need to include FASD within current service provisions. So we looked at the literature and we looked at lived experience as well. And it is true that many people have very little training about FASD in their original training. For example, nurses get like a very brief part in a lecture on FASD. Social workers, other service providers, it's usually covered very briefly, not very much in detail at all. This training aims at equipping service providers with strategies and resources across sectors. So we looked at specifically healthcare and public health, childcare and education, mental health and addictions, justice and corrections, and also community-based work. In all of these, you will come across people with FASD. We know from the literature that about 4% of Canadians have FASD. So if you think that you come across 100 clients or even 25 clients, you will have at least one of them with FASD. If you come across 100 clients in your practice, you've probably had 4 somewhere in there that have FASD. And often we don't know it because they're not always already diagnosed, not diagnosed, or maybe misdiagnosed. And Pascal will talk more about this. So this is why it's really important for us to realize that knowing about FASD, providing strategies and resources that work for people with FASD and their families and caregivers is everyone's job description. It reaches all these sectors that we've just mentioned, and it's important for all of us to have enough knowledge about it. So in this training has been reviewed by lead experts with different areas of expertise, as well as people with lived experience, and has been endorsed by CAN FASD, the Canadian-wide FASD experts. Why take this training? So it will help any service provider. So if you're an executive director, a manager, anyone who has a mandate to ensure professional training within your organization, this is what the training will provide your staff with. Accurate information on prenatal alcohol exposure and FASD, better screening and assessment of FASD as a neurodevelopmental disability in everyday practice. So it means you can refer people to the right services. You can help your staff to find out why approaches may not be working and use different approaches that we know have been effective with FASD. It will give them a much more beneficial understanding and make them feel that they're actually able to provide something that works for their clients. It's meeting the needs of service providers of the people that service providers currently work with. As I mentioned, 4% have FASD, so it's likely that everyone comes across someone with FASD at some point in their practice. And it's building the capacity for services and also for intersectoral collaboration. It means we can talk with other sectors, with other experts, and make sure that people are getting the right services they need, the right follow-up they need, the right referrals they need, and the resources they need. And it gives us an arena where we can collaborate effectively to support not only the individuals, but also their families and caregivers. It is part of professional development, and as such, as I said already, it applies to many sectors. It does fulfill professional development criteria. We looked at that throughout the development of the training. It is at least 4 hours long, and the way I say at least, the training will consist of, and Pascal will tell you about that, narrated slides, assessments, quizzes, reflective questions, and videos. And some of these you can expand on. So, if depending on the level of knowledge that each service provider wants and their interest, it can be longer than 4 hours, but each module is at least an hour long. It includes a knowledge assessment. In fact, each module will include a knowledge assessment. So that's an important part of professional development. And it provides a certificate of completion if all the knowledge assessment, the quizzes have been taken. And right now we have a CMA application in process. In progress, we have physicians involved in the development of the training. And now I'm going to hand it over to Pascal to tell you a little bit more about the training.
Thank you, Hilton, for that. I just want to say first, thank you for all service providers that are here today with us. We really appreciate your interest in the training. This training is answering a need in the community. So for quite a few years, we've heard from caregivers the crucial, importance of having FASD-informed services. And while there are many approaches to train people with neurodevelopmental disabilities or other disabilities, FASD has been quite under the radar for for long. And I once spoke with a public health person who said to me, we have a crisis, and it's an alcohol crisis. So it's not, people focus on opioids, they focus on other emergency issues. FASD is an urgent need. And I think that's something to say quite loudly. There's a ton of people with FASD that you may encounter in your practice and your services. And oftentimes, because the disability is not well understood, people do not get access to the services that they need, or they do access services, but that do not meet their needs. And really, we're hoping with this training that we're going to be able to build capacity in Ontario, and that's a provincial-wide training. So it's meant to increase capacity and hopefully, at the end of the day, provide better service with latest evidence and be able to curtail waiting lists and be able to reduce other incidents within services. So we're really looking forward for this initiative, and we're really grateful that we were able to put it together because we're hoping it's going to make a difference. And the way it's been designed was that we worked with community members, we worked with people with lived experience, we worked individuals and caregivers, we worked with service providers, whether they be doctors, other social workers, program managers. We've worked with occupational therapists. Uh, a bunch of them recorded videos that are part of the training as well. So it's really meant to be for and by the community so that it really addresses the need with the strategies that work. And that was another issue that we were concerned with, making it relevant to people in their practice. So it shouldn't be something new that people encounter. It should be actually something that we've seen quite a bit, but didn't know quite how to handle it, or what approach to take, or what strategies would be best. And Hiltrud, would you mind? Next slide. So each module, we have 4 of them, are divided into different topics, and the topics themselves, the modules, are in 5, no, 1, 2, 3, 4, 5, 6 sections. So the first one is the objectives, then some testimonies from people with lived experiences and professionals as well. And then we have 5 lessons. For each module, we decided to break into a few sections so that people can learn in manageable chunks. And there's a summary at the end with the takeaways, a closing word with a video recording of a professional who shares insight, and finally a quiz to assess knowledge retention to see whether or not you've learned new things in the module. Next slide, please. So the first one is why we should be concerned. And you know, I've worked for many years in the field. Oh, back one more slide. Yes, thank you. I worked for many years in the field, you know, as a frontline worker, as a researcher, and now as a health promotion consultant. So, and I've worked with people that had a lot of experience, and oftentimes FASD is not misunderstood, but you know, people don't realize until they hear the stories how much of a concern it should be. It's important because it's people that we care about, people that we love, and people that do not have the resources or the help to explore and reach their full potential. And FSD is very frequent. 4% of the population is a lot of people. And it, to an extent, you know, the services and the funds have not been um, an area of, you know, we haven't been strategic until very recently with leadership from government of Ontario to address this need. And what we see, you know, is the importance of diagnosis and early intervention. So the first module is really stressing the point of why a diagnosis is important, how it differs from other diagnoses that we may see, and more importantly, what are the things to put into place at an early stage to be able to improve outcomes over a lifespan. Second slide, please. We're going to talk then about the cost of misdiagnosis or non-diagnosis. A lot of people with FSD do not get a diagnosis, and that's because people were unaware of the term, or they were diagnosed with other concurrent diagnosis, and then people with FSD often get, you know, 6, 7, 8 diagnoses and a lot of medications as well, and that has repercussions in their daily lives. So we want to make sure that, you know, we avoid misdiagnosis, and by doing so, you know, it reduces costs, and not only financial costs but emotional costs as well for families, caregivers, and service providers. So being FS informed will lead to more efficient service delivery. Next slide, please. For trauma and resilience, we want to give a little space for really difficult issues that people encounter in their practices. I've been giving a lot of talks, and I've heard service providers saying that they felt inadequate to respond to very intense situations. And I know the first client I worked with was very intense, and I couldn't find the information I was looking for. The support of the strategies and sometimes very complex interventions that, in a healthcare professional setting or in a social service setting, we're not always sure how to respond to these things because it's a personal systemic crisis. Families are needing resources, and they have a life history behind them. And we often think of interventions in terms of responding to a specific situation, but we need to take into account people's trajectories and people's histories and memories, and to put really into place safety measures for everyone to be safe in the home and be able to build on strengths and nurture positive and safe relationships. Next slide, please. And finally, the last module is really giving concrete case studies for practitioners and able to implement, strategies and change, tweak service delivery in their different settings. The fourth module reviews different sectors such as education and childcare, healthcare and nursing, as well as social work, mental health and addictions, and justice and corrections. So not in that order though, but we really try to make it relevant for the most important sectors that are affected by FASD, that see people in their current practice, but may not be identifying it as such or may not be responding to it as such. And really the main feature of the fourth module is the need for uh, some sort of multidisciplinary work and teams. It's important that professionals of all sectors be working together. And sometimes, we see people with FSD informed approaches working with people in different settings, and they have a standardized program, or they have, knowledge that they received a few years ago, and it's been moving really fast in the FSD field. So things are changing not by decades, but by the year or by the months. And that's really important to keep up with latest research and evidence. And for that purpose, the fourth module is really showing ways that professionals can collaborate within other professionals in their field and discipline, but also with people with other sectors, so that we all are aligned toward FSD and respond to it from integrated, synergic approach, so that we're able to build a team around the person to focus on the person's need rather than working in silos and doing more harm than good. And what we've seen with people with FSD, we've all learned as professionals the importance of education and keeping up to speed with latest knowledge, because oftentimes it's dangerous to be rocking the baby too close to the wall. And that's one of the first lessons I've learned as a frontline provider, is to be conscious of where people come from to better tailor your services to their needs. So as part of the training, we've been really busy. We recorded 18 videos translated in French with captioning. So that means 36 videos, and they're from leading figures in the field. So we have, for instance, Svetlana Popova, who's a world leading expert who works with the World Health Organization, as long as working at CAMH. And we've had Nancy Lockwood, who's been working very, very hard for the last dozens of years. We have to build capacity in service providers doing education. We have Dr. Deji Ayon Rendi, who's a physician who's been involved in the process as well, to talk about issues from a practical stance. We really try to get different voices in order to give a full picture of what FSD looks like on a daily basis. And when you're taking the training, you don't need to view all these videos, but are accessible with the training for further ongoing education. So hours and hours of training if you want to learn more about specific issues such as, what OT strategy should I use, or what's a person-centered or a focus on strength approach would look like. I recorded one talk, for instance, on sexuality and FASD. What's the common issues that we see? We have one on safety planning in home. So these are the kind of topics you can learn more about if you click on the videos and listen to them. So please take this training. We encourage staff and all service providers to look into it. It will be accessible on the Provincial FASD website, so fsdinfostaff.ca, but actually, put a new in front of it because we have a revamped version of the FASD website coming up soon. It's going to be really slick and we're really happy and pleased with it. The training is free, so funding was provided by Ministry of Children, Community and Social Services. So it's an investment for the whole province to be able to uh, learn more and build capacity. And it will follow Accessibility for Ontarians with Disability Act AODA guidelines. So it will be in clear, accessible language with images, but not distractions. It will be simple and accessible to everyone. We want to also emphasize one last time that we are really pleased and happy that CanFASD reviewed the training so that we have the latest factual statements and knowledge. So do you have any questions? This is a webinar and we look forward to answering all of these questions today. So I see one from in the chat. Who is on this webinar? It is mostly FASD workers. We assume we don't see all participants. There's 100 of them today, but it's some of them are FASD workers. I want to say a quick word about that. FASD workers are more than welcome to share this training with other professionals that they know. So when they take it, they might not learn as much as other professionals, but this is meant to be a process, an ongoing process of learning. So if you want to refer people to the training, if you see things, that are relevant, we invite you to share it to other people. So we're hoping to rely on word of mouth to be able to make this training count for people who, and be useful for people who need it. So when will it be available, Hiltrud?
Had to unmute myself first. It will be definitely available by the end of April. We were hoping to have it available this week, but there's been a couple of little delays with video editing, and plus we have to get everything into French. So we will have it by the end of the month. You will see us sharing the link, the exact link. And do you have a course flyer that we can share? We are working on that as well. So all our promotional materials will come out and they are just being approved by our executive director and they will be ready to be shared within the next few days.
So we have a flyer, we have a web banner, and we have a one-page poster. We just need to get them approved, and we're gonna send it to everyone that asks us for them. And we'll have this promotion package. We'll have sample letters as well if you want to send it, or sample emails if you want to send it to organizations or professionals that you know of. We're happy to support you in whatever way we can, and we're going to post on our social media about the training, and we invite you to tweet or retweet about it and share it on Facebook as well, and use the hashtag service provider training when you do so.
Mm-hmm. And somebody's asking if there's pre-registration. No, there is not. When you get it, it will just be, you go to the link and there'll be registration. You register, you go in and you take the training. And if you only have a half an hour, you do half an hour and then you just go back to it. It should log you in at the point where you are, I believe. So so it's like an online training similar to maybe WIMIS or some of the other things that you've had to take. So you'll find it very easy to use and very user friendly.
And I just want to add to that that we worked really, really hard to make it, online training rather than a conference, so that people would be able to access it on their own time and take it at their own pace. So, even though the training is designed for 1 day, full day training session, it is breakable. It is 4 different modules. So you could say 2 hour and a half here, 2 hour and a half there. I do half of the training in the morning, and then I'll do the rest of it later. And then you get the certificate at the completion of the 4 training modules.
And yes, we will make sure that all who register today are included in getting the information and getting the flyer. So the flyer is like if you print it off, it'll be like a trifold. It will have quite a bit of information on. The poster will just be a very simple information with a link, and the web banner is the most simple information, and you can put it on your own website and make it act as a button that somebody can press to access the training. Is there a time period? No, there isn't. We did not set a time period because we do know that, things happen in real life, and you have good intentions to complete something in 2 weeks or 4 weeks, and sometimes it takes a while. I think eventually the system may lock people out, but it is like a long-term thing. So you will have a long time to be able to get to it. And how long will the training be? Forever, forever. Well, whatever forever is, as long as we have, as long as Health Nexus has funding to continue. We don't get ongoing funding from the ministry, but as long as we are able to continue the training and keep up with making the occasional update to it, we will keep that on the website and have it available.
I just want to also emphasize that the training will be, and the promotional material will be accessible in both languages, English and
Yes.
so you may have heard that I have an accent. So we're committed to content being accessible to Francophone groups as well. So no worries about that. It is already planned.
And I'm really happy to see that a few of you are saying, I'll share this with my team. What we'd like you to think about is think of 5 service providers you would like to share it with, or even 5 different organizations you would like to share that with. Feel free to do more, but that would be nice if you could think of that and share it with them. Um,
Well, we're quite overwhelmed with the positive feedback in the chat. We just want to say that we're really happy we were on board of a team to do these things. It was one of the most exciting projects I've worked on in my career, and knowing that it was for the FSD community and that it was important. We worked extra, and Hilton and I have been drinking a lot of coffee to make this happen. So, it could have gone sideways a few times, and we've been trying our best to make it the best product we could, so that people learn, that they enjoy the experience of learning, and that it changes the service delivery in the Ontario communities.
And somebody's asking, will we be sent an email once it is ready? Yes. I mean, in whatever way you got to the webinar today, it should come to you the same way. So if you're on one of our listservs, the FASD listserv or one of the other listservs, it will come the same way. Plus, we will do social media and some direct email communications to our stakeholder organizations and to all the group leaders and everyone like that. So, and we can make the list of participants from today a separate email list as well. You may just get it more than once that way. Okay, and then somebody's sharing, as a caregiver of a young child with FASD, I'm excited and grateful that the province and Health Nexus are putting out this training and encourage all professionals from all sectors to take this. Even if you're already aware of FASD, since it is a complex neurodevelopmental and physical condition, a refresher is always helpful. That's very, very true. And if you're not already aware, this information will help you understand how FASD manifests itself and will provide strategies for successful service delivery. Thank you very much. That was a lovely comment. Really appreciate it. Okay, more saying thank you for the flexibility, wonderful news. And here is a thank you in French. And remember, we're doing the webinar in French tomorrow as well. So for anyone who would prefer to hear it in their native French language, they can join tomorrow as well.
Or if you know any Francophone communities that need to, that would benefit from hearing about this news and want to learn more about FSD, please send them our way tomorrow at noon as well.
And on the training, somebody's asking if there'll be a full list of presenters. So the content of the webinar is actually mostly in the slides, but some of the slides are also accented by these 18 wonderful videos. So there will be a list. So we have it ready, a list of the service providers, or not service providers, of the people who are on the videos, the presenters. So 18 of them, they'll be there. You'll be able to click on, I'm not exactly sure what it'll look like, on a called resources or something, and up will come a few different things. The list with the presenters is one of them. There'll be maybe a photo of them, their bio, yeah, so, and also a full list of all the references used so that you can assure yourself that this is a credible, up-to-date, the content is credible and up-to-date
And
and evidence informed.
and please send us emails. So if you would like to have additional information regarding the training, we would gladly provide you with what we have so that we're able to answer all your questions.
Good, good. Yeah, so a few more comments and thank yous. That is really lovely. Thank you very much. And yeah, so I don't see any other actual questions. So say we don't need to. Somebody's saying, will we receive an email? Yes, we will. So I know you missed some of it. If you are able to speak French, you can join the webinar tomorrow, and we are recording it too. So we can leave it as a recorded session so that everyone can get the questions and answers and see the slides as well. And we'll send emails. Yes, we will definitely send emails out.
Well,
Anything else, Pascal, that I missed?
I think that's it. So I wish to thank you everyone for being here today. The FSD community will get new provincial-wide training, and we're hoping that this will be useful and relevant to you. And we look forward to releasing it in late April.
Yeah. And thank you again, everyone, for coming. And you remember your 5 sharing commitment. Thank you.